Mbewu, the Monitoring and Evaluation Officer of the District Council. Again, the representative from the District Education Office, Mr. Matope. In our midst, ladies and gentlemen, we also have the Vice Board Chairperson of Youth Media and Counseling, Mrs. Kapagawani. My humble duty this morning is to welcome you all to this function. As we are all aware, we are calling it a dialogue with the African young leaders. And amidst us, our guests, it's a variety, a cross-section of young people who have distinguished themselves as leaders from the civil society, from development organizations, from business, from faith institutions, from the media, who have a bright future, but again, recognizing that the next generation or the next Malawi, they are there to lead the country. Our dialogue, as I said, recognizes people around this table as young leaders from a number of institutions. People that have come out and take up the leadership mantle, people that have braved themselves enough to come out and lead in a number of institutions, from the civil society, from youth networks, from the media, from government departments, from faith institutions, from the business sector. And again, as we are calling it, listening to the African youth, the challenge of HIV and AIDS on youth participation in good governance. Two broad areas, HIV and AIDS, recognizing HIV and AIDS as one of the major impacts that are impacting on the young people today and Malawi as a whole, but again, good governance as a tenet for our democracy. So let me welcome you all to this discussion. And let me invite you all to freely participate in this discussion and again, make sure that you are flexible to contribute whatever you can for the benefit of this discussion. At this point in time, ladies and gentlemen, let me call upon Mr. Gonwe, Mr. David Gonwe, who is the Deputy for Balaka District Council, to give us his welcome remarks.
Madam Lisa Vickers, the acting USA Ambassador to Malawi. Madam, on behalf of management of Balaka District Council and on my own behalf, my duty this morning is simply to welcome you to be part of the dialogue titled Listening to African Youths, the Challenge of HIV/AIDS on Youth Participation in Good Governance here at Isimeho in Balaka District. Madam, before I request you to address the gathering, here allow me to say a few things. Gathered here, Your Excellency, Madam rather, senior members of the Balaka District Executive Committee and the key representatives of the non-governmental organizations operating in the district and indeed the youth. Let me also take this opportunity to bring to your attention that the District Council has an active and a vibrant district AIDS coordinating committee, and with that, it has managed to put in place a harmonized district implementation plan on HIV and AIDS to ensure that there is harmony and consistency in the implementation of the various HIV/AIDS interventions. For instance, Madam, we in the DIP have some activities which are directly targeting to the youth. In this case, we are talking about all the 5 pillars of prevention and behavior change, total treatment, care and support, impact mitigation, mainstreaming and capacity building, and research and evaluation. Now, in the course of implementing these pillars, almost all the important agents are involved. We have got the Office of the Education Manager, the DEM, the youth, we have some specific NGOs like Chinasi Foundation, we have YONECO. Let me mention that YONECO is very instrumental in these things. It has a number of programs, and just to name a few. Madam, most of the youth in in Balaka district are now active in responding to the pandemic. This is done through their positive participation in decision making and the implementation of HIV and AIDS activities. They do all this mainly through community-based organizations and more especially on the part of the youth through the youth clubs. This is in line, Madam, with the Malawi Growth Program Strategy under the priority area on prevention and management of HIV and AIDS and nutrition disorders. This is in line with the government programs. Madam, at this point in time, let me just give a plea to all members to fully participate and contribute fully in the dialogue. Thank you very much and feel welcome.
Okay, first of all, good morning. And I'm sorry that we're starting a little bit late, but better late than never. David Gondwe, Director of Planning and Development for Balaka. Owen Chikwaza, the District Health Officer. Peter Chambo, District Monitoring Officer. Our friends at Zodiac Broadcasting Company. And, most importantly, all of the youth leaders in this audience that I'm looking forward to hearing what you have to say. And I'm delighted to be in Balaka. I've driven through many times as I've been traveling the length and width of Malawi. And this is the first time that I've actually had a chance to stop and actually meet people here in Balaka. I've driven through many times as I've been traveling the length and width of Malawi. And this is the first time that I've actually had a chance to stop and actually meet people here in Balaka. But it's also not a coincidence. It's very easy for us to hear what the youth of Lilongwe and Blantyre think about good governance and HIV. And it's not as easy for us sometimes to hear what youth in other more further away from the capitals, what they have to say. And so that's another reason why we're here today. We were determined to hold this discussion outside of Lilongwe and Blantyre so that we could get some different perspectives. This morning's discussion is an extremely important one for Malawi. Listening to African youth, the challenge of HIV/AIDS on youth participation in good governance. Now, I want you to think about something as I'm speaking, because it's going to be very important as the discussion continues. I want you all to think about, what does good governance mean? What is the meaning of good governance to you? When you hear that phrase, what do you think of? So keep that in the back of your mind as I'm speaking. This title that we have brings together three key themes: health, youth, and governance. And how Malawi handles these issues will in many ways determine the country's future development. For example, the fight against HIV/AIDS needs both government transparency and motivated youth who champion anti-HIV activities, because as I'm sure you're all aware, the HIV rate grows the fastest among youth and women. President Obama has often made the point that transparency promotes accountability in government. And young people represent over half of Malawi's population. Most of them live in poverty and are seldom involved in the country's decision-making. I'm proud that the U.S. government has helped to sponsor a forum like this for young Malawians to express their ideas and observations about how HIV/AIDS and governance are affecting you. But let me be clear, we are not seeking to prescribe the solutions to Malawi's challenges. I have full confidence that all of you are perfectly capable of coming up with the ideas that will move Malawi forward. Even President Obama has said that the solutions to African problems must come from Africans themselves. So you might be asking yourselves, why is the United States getting involved in events like this? And we do this because building strong relationships with Africa's emerging young leaders, tapping into the strength and the potential of African women, investing in the health of children and youth, uphold core American values, and advance American interests. And today's discussion is not an isolated one-off event. Rather, it's part of a larger initiative, that President Obama has personally spearheaded, called the Dialogue with Young African Leaders. Throughout Africa, we are helping to showcase the efforts of young leaders to engage with them in discussions about current challenges on the continent and to help them discover ways to bring about positive changes in their communities and in their nations. Since May 1st, my colleagues and I have co-sponsored almost 200 events across the continent. And this dialogue is part of our long-term engagement stemming from the President's Forum with Young African Leaders, which took place last August. And as you may well know, Mr. Lambani was one of Malawi's delegates to this special forum last year, and he spoke directly with President Obama during a televised town hall event similar to this one. In that same spirit of engagement, the First Lady, Michelle Obama, will be coming to South Africa and to Botswana later this month and will deliver a keynote address to a U.S.-sponsored Young African Women Leaders Forum in Johannesburg. Forum participants will also include young women from across sub-Saharan Africa, including from Malawi, who are leading social and economic initiatives in their own countries. Just as the First Lady will in South Africa later on this month, I look forward to hearing what you all have to say this morning. And my goal is for my fellow Americans to understand what young Malawian leaders in civil society, business, and government are doing to motivate youth. Your generation will shape Malawi's future and Africa's future, and we must highlight your endeavors for a global audience. Along those lines, I'm pleased to add that news of Felix's work has been featured in American news outlets on the internet. And for those of you who are Facebook aficionados, you can friend us. We have our own page, and in fact, you'll probably see pictures of yourself as well as information about this forum highlighted on our Facebook page.
Well, I would say that this is not a new thing. Issues of HIV and AIDS, as well as good governance, have actually affected us, and they're still affecting us. And so we're more than pleased to be here and then be part and parcel of the decisions that have been made this morning and see how we can actually influence the change that we can do more. Thank you so much.
Another hand, how relevant is this topic? From your own perspective, how relevant is it? Pick up the mic, introduce yourself and the organization you're representing.
My name is Zulu from Balaka. This topic is so sensitive as far as I'm looking at it, just because the nation is depending on us to build a next generation. Ernest Mahayo, one of the editors for One for Billion. Mkuu wambili mambo kuza ulandulogo masoti ya nalena HIV wakati batu nadati jamana chukua watu maida na ulamili kwa kusali leo hayote aje nyama tusoba na Facebook immediately kulenga umbali wali baada ya
central to this thing is this idea that as human beings we have to propagate. We have to have a new generation after ourselves. Now, here there is a challenge. If somebody is HIV positive, but has to give birth to another person so that he can take over after him or her, there now is where we are entangled. Because when we go into the hospital, we are advised, if you are HIV positive, there are so many dangers if you get pregnant. Because they are coming off screen. There are high chances that you can get HIV. Now, what about the 50 years to come? Where are we going to be? So this really is a very sensitive topic, I would say. Thank you.
Let me appreciate for giving me this report to contribute. On the aspect of magnitude of relevance, I should indicate this that the really is quite relevant, and it does really to be discussed thoroughly so that we map the way forward for the area. Otherwise, I wanted to start by agreeing with the speeches which have been made so far, like on the aspect of governance, issues of HIV/AIDS. Really, I think all of us would agree that this pandemic is it's really quite relevant to tackle that one and share it accordingly. I wanted it to indicate this that from the speech on the aspect of governance, we understood that it's not like we were looking at one thing. There was by definition which was given, we are looking at the way institutions are conducting the affairs of their respective institutions and in a way manage the public resources. And all that is done in the dimension of our development which we want to achieve on the ground. So we are being affected by this challenge which Nigeria has to achieve those set objectives or goals. So on the aspect of governance, he indicated a number of elements which are quite key to make sure that what is there is good governance. So I was looking at the three dimensions which need to be triangulated quite properly. I'm looking at the youth, which is of concern, and we're also looking at the HIV and AIDS pandemic, as well as the governance. So these three have to be triangulated accordingly. Triangulation in terms of those elements which have already been indicated, like issues of participation. How is the youth participating in the issues of HIV and AIDS? Because we're owning that is really our challenge in our midst. So really, there are a number of elements which were highlighted, like issues of decision making, efficiency, effectiveness, transparency and accountability, whatever. All those dimensions, once we are given the mantle to sort of like implement a particular intervention in the line of HIV and AIDS, do we really own that? Because the element of ownership is quite important. Otherwise, we can't do things haphazardly. So, really, we need to undertake that in a professional manner. And with that, by the end of the day, we will really address the challenge which is in our midst.
I'm Ms. Margaret Ukio, representing Andiamo Youth Cooperative Trust, Education Department. I'm the headmistress of the secondary school. Okay, I would like to agree on the relevance of the topic we are discussing today, more especially by looking at the youth alone and good governance. If we take out HIV and AIDS, we still see that there is a challenge the youth of today are facing with good governance. Most youth in our society are not given a chance to make decisions, mainly because of the traditional beliefs we have, even in the organizations that are where we're working. A youth to take a leadership role, some people would look down on the youth, saying that he doesn't have experience in this. We cannot listen to this one because she is a youth. But still, we are humans, and we also have civil rights. We can also think, but they don't give us chances. So if we have these dialogues more and more often, I think the youth can come out and participate in good governance. And also taking the point that the youth and also women, of course I'm a woman, I would also talk about women. Women, we are widely considered as a marginalized group. For many years we have been in the underworld. So if we could have these talks more often, and if we could have at least equal representation, like here we only have a few women, and that also is lack of participation. We need to have more women in things like this, and that would lead to decision making, because it is not only at the government level, but any level of participation is good governance. So if we could have these things at any level, it would enhance good governance. So if we take HIV/AIDS and put it on the youth, that's what I would second one of the speakers said about child-headed households. If you go into the villages, you're going to find many children who have dropped out of school because they have siblings to look after. How can this one participate in anything? So we need to really help one another and focus on how we can participate in any way in enhancing good governance at any level of the society. So this, I agree, is a good idea amongst the youth.
I just wanted to make a comment on the relevance of this dialogue. This dialogue session has really given us an opportunity as the youth to remind decision makers on the University Declaration of 2001, where member states of the UN committed themselves that by 2010, 95% of young people who have access to information, skills and services they need in order for them to decrease their vulnerability to HIV and AIDS. But we are talking of 2010, where Malawi is one of the member states of the UN, and they signed on that. But today is 2011. Have we reached the 95% of young people having access to information, skills, and services that we need to reduce our vulnerability to HIV and AIDS? So this has really given us an opportunity to remind decision makers, because we should not, decision makers should not only be good with having good policies and then failing to implement them. So this is really an opportunity for us. Thank you very much.
As was made very clear by the District Health Commissioner, women are disproportionately affected by HIV. And so, of course, having their participation will make a huge difference. But I have a question, I have actually two questions. One geared more to the women, but one in general. My question to the women is, what do you feel is the most difficult obstacle to overcome to lowering the HIV rate in Malawi, particularly amongst women?
I think that the most challenge that we're facing, I think from my experience with working with young people, young women, I think the most difficult challenge is traditional practices. Traditionally, we are told we are not supposed to speak up when we are men around us. Traditionally, we cannot talk about, express ourselves because we are told we are women and we're not supposed to speak in public. And sometimes because of the kind of practices, like my colleagues have already said, as women, we are victims of most of the kind of practices that we have. From the DHO, I think he has already explained of the global PUFA in Kikwa. In Kikwa and Sanjam, the southern region, we have in Hena, where a young girl will be given to, say, if a man marries in a family, and then that man is seen as a successful man, maybe he's doing a business and all that, the family gives the younger sister as a prize, a bonus to the husband. So you look at such, yeah. So looking at such girls, they're given to the elder sister's husband at that young tender age. They drop out of school, and if they drop out of school, it means the opportunities that they will have had in life, maybe to enable them to speak up, have been retarded. And I think that's one of the reasons that women fail to take up the responsibility to speak up and maybe participate or protect themselves against it.
Most of the problem, women ourselves, we say, oh, I cannot stand among men because they can laugh at me, I cannot manage to rule. So the most problem, even they can give a chance to us, we say, oh, I cannot manage. Because people, men always, they are mostly, we call men, they are at top rank, they can say whatever they can. Always women, we say yes, we don't say no. So that's the main problem. Ourselves women, we don't like to participate. we have also learned that the issue of poverty is key to this, because most women, they are illiterate, but at the same time, they're not able to find daily bread. As a result, they cannot stand on their own, and they depend on their husband. At the end of the day, they cannot make decisions. They cannot stand on their own. They rely to someone. And then on the issue of low self-esteem, it's also a challenge to women. You can give chance to women to stand up and speak, but if they're not able to have that self-esteem to say, I can make it, I can do it, it also becomes a problem for women. But key to this is about economic levels, because most women linked to literacy levels, they're not able to earn anything. At the end of the day, they rely anything to their husband. And even the issue of gender-based violence is also coming in, because most women, they're being affected almost each and every day because of issues of literacy levels and then economic. Thank you very much.
From US Embassy. I just want to comment on the issue of low self-esteem, which is really one factor that make the women not to participate in most of the decision-making issues. Well,